In 2024, the COVID-19 pandemic continues to impact the United States in multiple ways, including vaccine updates and changes to isolation guidelines and preventive measures. Developments in vaccines. In fall 2024, the U.S. Food and Drug Administration (FDA) recommended the use of an updated vaccine containing the Gen 1 strain of the SARS-CoV-2 virus, after studying and analyzing data on the effectiveness of current vaccines against newly circulating variants. Later, manufacturers were directed to use the KP2 strain, if possible, to ensure better matching to the strains in circulation. 5. FDA recommendations for groups most at risk. For additional protection, the Advisory Committee on Immunization Practices, a CIP, has recommended that people over 65 receive an additional dose of the updated vaccine 4 months after the previous dose. People with weakened immune systems are also encouraged to receive additional doses based on doctors' discretion. 6. CDC infection rates and isolation guidance data from the Centers for Disease Control and Prevention (CDC) showed that infection rates vary between states, with daily infection data continuing to be monitored and analyzed. The transmission rate (RT) indicates growth or declining trends in infection, with values greater than 1 reflecting growth of infection, while lower values mean it is declining. Even so, with regard to isolation guidelines, the CDC has simplified the recommendations so that the same guidance applies on all common respiratory viruses, such as COVID-19, influenza, and respiratory syncytial virus (RSV). Individuals who develop respiratory symptoms are advised to stay home until symptoms improve and fever has disappeared for at least 24 hours without the use of fever-reducing medications. After that, additional precautions must be taken for 5 days, such as wearing masks and social distancing. JHSPH, other preventive steps. A comprehensive strategy to prevent the spread of respiratory viruses includes getting recommended vaccinations, practicing good hygiene, improving indoor air quality, and knowing available treatment options such as antiviral medications in the event of infection. JHSPH. Conclusion. Despite ongoing challenges, the United States is showing progress in confronting COVID-19 with ongoing updates on vaccines and prevention guidelines. Preventive measures and adherence to public health recommendations remain the first line of defense in limiting the spread of the virus and protecting the groups most at risk. Complete long-term effects and public health measures. Long-term effects of the pandemic. Despite notable progress in the fight against COVID-19, the pandemic continues to have a significant impact on American society. There are still a number of long-term health issues that people who have had COVID-19 face, such as post-COVID syndrome or long COVID, which includes a wide range of symptoms that persist for weeks or even months after acute infection. These symptoms include chronic fatigue, breathing difficulties, problems with concentration and memory, and pain in the muscles and joints. CDC. Ongoing public health measures. Continuous vaccination. Vaccines play a vital role in limiting the spread of COVID-19 and reducing severe symptoms and deaths. The CDC recommends that people receive booster doses as needed, especially those most at risk, such as older adults and those with chronic diseases. CDC. Individual prevention. The CDC stresses the importance of personal protective measures, such as frequent hand washing, wearing masks in closed and crowded spaces, and social distancing when possible. In addition, people with respiratory symptoms or fever are advised to stay home until their condition improves. JHSPH. New isolation guidelines. The CDC has updated isolation guidelines to be more convenient and easier to implement. Instead of isolating for a specific period for each case, the new recommendations are based on the improvement of symptoms and the resolution of fever. After the isolation period ends, people are advised to take additional precautions for 5 days, such as wearing masks and social distancing, to ensure that they do not infect other sites. JHSPH. Improving indoor air quality. Improving indoor air quality is an essential part of the prevention strategy, as good ventilation of indoor spaces and the use of filtration systems can help reduce the concentration of airborne viruses, reducing the possibility of transmission. Our GHSPH to conclude, in the face of the ongoing challenges of COVID-19, it is essential to continue adapting to changing circumstances and updating preventive and health strategies based on the latest scientific evidence. By adhering to health recommendations, getting vaccines, and ensuring individual prevention, American society can continue to make progress toward overcoming the pandemic and reducing its impact on daily life and public health. In conclusion, I hope you enjoyed the content of this video and benefited from the information we provided. If you liked the video, do not forget to press the like button and subscribe to the channel to support us and to follow all new updates. I would also love to read your comments and suggestions for topics you would like to see in the future. Thank you for watching, and we'll see you in the next video.